Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then uses of ACE inhibitors. So ACE inhibitors are actually drug of choice for many conditions. They are drug of choice for congestive heart failure. For all the stages of NYHA classification, we can give ACE inhibitors. These are also drug of choice in hypertension. They can be used in nephropathy, especially diabetic nephropathy or non-diabetic nephropathy, because these ACE inhibitors have a positive or good effect on the kidneys. Thus, because of their renoprotective effects, they are used in the nephropathies, that is diabetic nephropathy or non-diabetic nephropathy. We can use these ACE inhibitors. They are also used in unilateral renal artery stenosis. But remember, for unilateral artery stenosis, they are the drug of choice for unilateral artery stenosis, but they are contraindicated in bilateral renal artery stenosis because they cause venodilatation. So because of their action on afferent arteriole of the kidney, causing the dilatation of afferent arteriole, they are used in unilateral renal artery stenosis, but they are not used in bilateral renal artery stenosis. They can be used in conditions of retinopathy or scleroderma crisis. Also they are used in MI. They are used mainly to prevent the infarction, prevention of expansion, for the prevention of expansion of infarct, to prevent that the infarct does not expand. So we can use this ACE inhibitors.
thank you and thank you for watching.